Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good, Amy. How are you doing today?
I'm good. Yes, it's a beautiful day. It's hard to complain.
I know, it's very hard to complain. So what's our topic?
We have a cool topic today. So we're going to talk, it's called Let's Talk About the Immune System, but really we're going to be talking about supplementation around the immune system. Pretty hot topic these days.
Why would it be a hot topic?
Well,
who knows?
For me, the immune system is always a hot topic for me.
Right.
But there are a lot of misconceptions about supplementations and supplements in general and what's safe and what you should take. It's in times of stress, people tend to maybe go a little overboard, think that a supplement is going to cure something or fix something.
Yeah,
and it may or may not.
The snake oil phenomenon.
Yeah, it's true. And supplements are not well regulated. So you can buy a lot of things online and start taking them without ever talking to your doctor or nutritionist or anybody else, and may or may not be a good thing to do that.
Right.
So,
and I do think right now, for a lot of reasons, like focusing on your health and your immune system is really, really important. And the information out there is somewhat hazy. And obviously at times of stress and times of problems like this, people tend to take advantage of that, and they promote things that maybe don't have a lot of scientific basis to it, that things are done for money. So getting real information out there for anyone listening, for the people that listen to our podcast, I think is really, really important right now, right at this moment.
Yeah. And, as a nutritional therapy practitioner, I'm very much not a pill for an ill kind of person, but a lot of our Western medicine society is, so people want to believe that there's some, like you said, the magic beans or like some magic sauce that can fix everything that's wrong with them. And there are a lot of borderline unethical businesses and people who put information out online and put information out on their websites. And some of them may be really well-meaning, but taking supplementation without really thinking about it or taking into consideration that there could be downsides to it is really not a great idea.
Yeah.
So we're going to kind of talk about that.
One thing on that, like on social media and stuff, we follow a lot of people in the fitness industry, and there's some people coming out with these ideas of exercises and certain things that can help your immune system. It doesn't mean that it's not the case, but applying that to infections and viral infections and stuff, I don't think is really applicable from a medical standpoint. So
Right.
What we're going to talk about today is real information, things that we know will help your immune system. But again, everyone's different. So if you're thinking about doing some things for yourself, I personally would actually ask your doctor about it too.
Right. Or at least work with somebody who knows your health and your background and medications you're taking. With all that said, if you're interested in seeing the slides that go along with this podcast, you can find those on YouTube at Jason Martin MD. We've got some good slides today. So here's the first one. If you're watching, you will see.
What the hell is that?
Right.
This picture looks like Nils's beard right now.
Yes. This is the immune system. This is how the immune system functions.
By the way, Nils needs a haircut. Can we have an episode on Nils's?
Oh, sure. Now that you don't look like a werewolf.
I'm high and tight.
Yeah. Now you're throwing shade at those.
I'm fresh and clean.
Yes.
All right.
So.
The immune system's so complicated.
It is. And that's, where you were talking about before with, online resources, talking about ways to boost your immune system. Your immune system is not going to be suddenly changed by very small things because it is a complex system.
So, for example, if you just take a crap load of zinc, is that going to change your whole...
Let's wait and talk about that when we get to that.
Okay. But that's an idea. Like some people think you just take one thing and it's going to change all the aspects of your immune system.
Right.
It really doesn't. Yeah.
Well, as you can see, there are many things happening all at the same time. So next slide is the adaptive immune system in a nutshell. Now, there are two types of immunity. We've talked about this before on the podcast. You have your innate immune system, which is the immune system that you are bequeathed with at birth. You get it from your mother. It's in your DNA. It's the immune system you have the day you're born. Your adaptive immune system is ever changing. So I got this picture from the vaccine mom. I don't know who she is, but she has this great, very simple, here's what the immune system does. And this is what most people kind of think about when they think about the immune system. You have these like crazy T cells and they're out there like fighting, And
I think I would have learned more in medical school if the cells would have had faces like this.
Right? And look at this guy, like the cytotoxic T cell, like off to kill germs. He has like a staff, like this guy, I don't know what he's holding, like the helper T cell shows the antigen to B cell. So the immune system on a very simple level has a couple types of cells, primarily T cells and B cells. Like they do different things. They learn about diseases. So They go get information from a cell that is infected, and they learn about it, and they learn how to fight it.
Yeah.
And then they tell other cells how to fight it.
I really like your summary of this.
You like my version of the immune system?
I'm going to go back to my biochem professor with this slide and your summary and see what he says about that.
Yeah. So,
but there is we have two different types. We have the adaptive, what you're talking about, which responds to antigens or foreign things that come into your body, and it's not just viruses and bacteria, it can be anything, proteins and things like that.
Yeah.
And we have the innate, which is primarily what meets these things at first. They're the ones that come in contact right away with anything that's in your body that shouldn't be there. So two different types that these work together and symbiotically. The innate presents the antigens to the adaptive, and you get this whole process. It's really interesting if you want to read about it or not.
Yep. No, I mean, if all you need to know is that your immune system is killing bad guys, regardless of how they get in, that is true.
America.
Yes. Like this, your cytotoxic T cells are going to kill everything inside.
We should have fireworks right now.
Right. So something can happen, though.
This is like this is Amy's version of please don't say anything more scientific because you're going to lose the audience.
Right. We get real deep. Okay. And this is, the immune system, as was shown in the first slide, is extremely complex and involves a lot more than just this. But on a very basic level, we kind of understand that our adaptive immune system is what's helping us fight infections. It's helping us do a lot of things on a daily basis, helping wounds heal. It's helping out, keeping us alive.
Yeah, really. All the parts of living related to injuries and infection, any type of infection and cancer, the immune system is imperative. If this is dysfunctional, meaning that if you have a disease that doesn't allow, even like HIV, AIDS, you've heard of that, any process that messes up the system can be in most cases life-threatening.
Yeah, and HIV is actually an interesting one because it tricks the cells into thinking something different and then is able to replicate itself.
Right.
So it actually gets into your cell and makes the cell replicate the virus by kind of tricking it to think that it's not.
Yeah, and these viral infections, even the ones that not to be named like currently, they all do that. They get in the cell and they downregulate certain proteins, which decreases the ability of the immune system to work against that virus. So these are evolutionary things that they've collected over time. They developed these viruses and bacteria.
Yeah.
So,
and something to that same train of thought that happens when your immune system is really under stress is this, the cytokine storm.
That's a cool slide.
It is a cool slide.
You got to look on our YouTube channel.
So this is also another really hot kind of buzzword right now, like what is a cytokine storm? And I think there may be a misconception that this is somehow a new occurrence with a new disease or a new virus. It's not. So the first time that cytokine storm was actually just really kind of discovered or brought up in medical literature was back in 1993, but it didn't really become well understood and really kind of named until later than that, even into the early 2000s. So basically a cytokine storm, cytokines are part of our immune system. They're part of those cells. When everything is super out of whack and it just starts attacking everything. And they see this in patients in the hospital with sepsis. That this cytokine storm starts, they have a small infection, but the immune system overreacts essentially and just goes crazy and starts attacking everything. Because, your cells are kind of programmed to die and can send off distress signals to other cells. But when that gets kind of out of whack or your immune system's going nuts, it can start to attack healthy cells. And you see that in autoimmune conditions.
Yeah.
So an autoimmune condition is just basically your body attacking healthy cells like Hashimoto's, thyroiditis, your body starts to attack the thyroid. So things can definitely go a little bit askew in the immune system, and it's not a good thing. So a cytokine storm is just a really freaked out immune system on a really basic level.
So that's another thing, a lot of something that potentially is good for you can be harmful.
Yes. Yep. Yeah. So not a thing to be it's not a great situation, but it's not something that is new or related directly to anything current.
The cytokine storm is, in some ways, with these viral infections, is really what gets people into the ICU. I mean, the current one we're dealing with now deals with the lungs, but the cytokine storm is a big reason why people go to an ICU setting, because once that occurs, you become very unstable physiologically. It's really hard for your body to regulate, and your organs start failing. It becomes a real bad problem. So you have to have mechanical support in most of those situations. So it's a real bad problem.
Yeah, and it's bad regardless of why it starts. It's not a great thing. So that's what a cytokine storm is on my My very happy dumbed down version of the immune system. So there are many types of cytokines, and this is something else that I think.
I don't think we're going to be able to give a CME after this, like CME credit.
You're not getting credit for
educational credit.
No, don't write for your CME credits for this one. Yeah. So there are a lot of types of cytokines. Some of them do good things, some of them do not so good things. You kind of see a list of the 5 main types of cytokines.
So you have interferons listed, interleukins, chemokines, colony stimulating factors, and tumor necrosis factor. So tumor necrosis factor is big in obviously cancer. Chemokines are with everything, that any cellular process. Interleukins, IL-1, that's big into wound healing. We learned all about that in plastic surgery. You should look into wound healings. Interleukins are big, and interferons too for the antiviral properties.
Yeah, and like I said, a lot of these can be very pro-inflammatory. And again, that's part of the problem when you have this cytokine storm happening. Inflammation in like your blood vessels and inflammation of other tissues in the body puts your body in a state of extreme stress.
We use a lot of these things for therapies. Interferons we use for therapies in cancer, you know, and these IL-1, IL-3, all these different interleukins. There's so many different therapies coming out that are utilizing these cytokines in a positive way.
Right, to deliver things.
Yep.
Yeah, because they really get around. And also blocking them, like blocking TNF is something that's looked at for treating certain types of cancers.
Right.
So, these are really awesome cells in your body, but again, that's kind of when they go out of whack, they can have a damaging effect because they can increase inflammation, they can break stuff down.
What's the movie when they have like 24 hours and everyone can murder everybody? My daughter was watching that. The Purge.
Yeah.
So that's what like a cytokine storm is.
It's like killing everything in sight.
All of a sudden, like there's no more rules. Like it's complete carnage.
Right. And getting a little deeper into cellular biology, if you think about it, like we've talked a lot about the cell, the phospholipid bilayer, a lot of these viruses and other things attach onto that cell wall and cause it to like erupt essentially. So when that happens, all the toxic stuff that's inside a cell gets out into the interstitial space. And that can have a negative effect too. So now you have all these, byproducts of cell and like ROS, the reactive oxygen species, now going crazy too. So that can cause further inflammation, more white blood cells, more, of these cytokines coming to the site to help with the injury.
So with what we're dealing with currently, the hypercoagulability is because of that, and those endothelium of the blood vessels, when it opens up, it releases von Willebrand's factor and factor 8. And that's where you get those blood clots from.
Yeah.
So it's just like any other damage. If you took a knife and went through the blood vessel versus the virus opening it up and causing damage.
Right.
The same result. You get massive clotting, which has been shown to be really problematic for some of these patients.
Oh, absolutely. And your body's just trying to fix what it perceives as being wrong.
Right.
So but sometimes it just goes a little too heavy on the attack.
Yeah.
So let's talk a little bit about blood sugar regulation in regards to functioning of the immune system. And I think this is something that a lot of people maybe don't make the correlation between. So it's something that happens sometimes to people, even that are hospitalized for other reasons, that you get this very acute effect of hyperglycemia. And this can happen for a lot of reasons. And I think most people associate this with diabetes, right? Diabetics have hyperglycemia or obesity, but there are a lot of other things that can cause your body to go into a hyperglycemic state that may not be a chronic condition. It just takes a triggering event. So whether that's that you have diabetes, you have obesity that's causing your blood sugars not to regulate, stress.
Yeah.
Failure of the pancreas obviously is going to cause that to be an issue. And other drugs.
So your pancreas releases insulin. Insulin helps you take glucose that's in your blood and bring it into the cells, primarily muscle cells, but every type of cell.
Yeah, liver.
So hyperglycemia is elevated blood sugars. When I was in medical school, so the biochem teacher said, it's almost impossible for someone with a normal functioning pancreas to become hyperglycemic.
Not true at all.
Totally not true.
Nope, not true.
We tested it. We were in the ER rotating, and it was like a slow night. And so I remember
high blood sugar?
I drank 2 Cokes and had like 3 pieces of cake. Number one, I've never felt so terrible in my entire life in a very short period of time.
Right, that's like 200 grams of sugar.
Oh, it was something insane. And we measured my blood sugar like in 15 to 30 minute intervals, just a blood stick or a finger stick. And it definitely went over 100. It went up to, per memory, like 125.
Yeah, I wouldn't be surprised if it maybe would have even gone up higher.
Yeah.
And that's like the glucose tolerance test. I've had to have that done. And like they make you stay there because drinking this much of a sugary liquid that quickly can make you feel really sick. And I was like, oh, I'll be fine. Like I brought my computer. I was like working and like maybe about a half hour after I took it, I'm like, I got to lay down.
So the glucose tolerance test, where do you take that?
You do it at the lab, because they have to draw your blood at certain intervals.
Oh, so you stay at LabCorp or
You
whatever?
have to stay.
Oh, I didn't know
And it
that.
takes like 3 hours.
Oh,
and you have to keep drinking this like intense,
So what were your results?
I was fine.
Oh, okay.
I passed.
Screw immunology. I want to hear about your
Right?
results from the
I
quiz.
passed, yeah. I mean, this was years ago, but you do it fasted, and that's part of the problem.
So I want your score so I can beat it.
Okay, well, we'll
if
make
that's
you
possible.
go. We'll go do the glucose tolerance test together.
We'll tell the lab person, well, listen, this is a competition.
Yeah.
Do not tell her my score. I don't want to know her score till the end.
Right, send it to us, and we'll see.
Yeah.
We'll reveal the results. So back to blood sugar regulation. So why does blood sugar regulation have an impact on the immune system?
Glycation.
It is. It has a lot to do with AGEs, advanced glycated end products.
Mm-hmm.
So that's something I talk a lot about as a nutritional therapist. It's
What is
basically...
what is glycation?
So glycation is basically making your cells sticky. So glycation happens like it's that same process that makes toast turn brown. We call them AGEs, AGES, advanced glycated end products.
I love that brown toast stuff.
Well, no, that's fine. But I'm saying that's kind of that process that causes the cell to kind of change and become different. Your cells can actually become sticky, so that other things that should not be there stick to the cell membrane. And then you've got this cell. I mean, like if you think about like if you drop a piece of candy that's been in your mouth on the ground or in the sand, that's like that. Like it's sticky on the outside, and now all of a sudden every piece of sand in a 100-mile radius is stuck to your Jolly Rancher. So that's what happens. So that causes more of these to accumulate around the cells. We talked about an increase in reactive oxygen species that breaks down DNA.
So you get the glycation, makes things sticky, and then bad things happen, right? And then you get inflammation, reactive oxidative species being released.
Yep.
And what's the end result of all that?
So the end result of all of these things, so we get aberration in the regulation of RNA. So the RNA is not regulating itself as well. All of these things, if you look at the end of the slide, so we've got DNA problems, RNA problems, and protein issues. Most of what's happening in our body are little bits of proteins, and we'll talk more about those
So if you look at the way the cell cycle works, which I just went through this with my daughter at home schooling. Thank you, school. So the DNA is the blueprint. DNA, then it gets transcribed to RNA, or gets converted to RNA. And then RNA gets transcribed to proteins. And the proteins are how cell functioning works. And that's the basis of how these cells function. The DNA is the blueprint. RNA translates the blueprint and then ultimately makes proteins.
Right.
And if that becomes altered, especially when it comes to your immune system, I'm sure that the functionality decreases and becomes problematic.
Right, because we have issues with post-translation modification. So as your DNA and RNA are kind of replicating, and you can have little chinks essentially in those, and they aren't making as good of a copy. That happens anyway as we age, but it gets accelerated when you're in a hyperglycemic state. Up-down regulation of oncoproteins. That's something you probably talk a lot about, your tumor boards.
Well, tons.
A lot. Inflammation. That's the big one. Inflammation goes up. The other thing that happens is you get this kind of accumulation of just stuff that can't be processed. So if you look at the very bottom of the slide, alteration at any level eventually contributes to neoplastic transformation, which means that the cells are becoming neoplastic, or they're not right.
They're not behaving correctly.
Correct.
Yeah, it's the purge again.
Yep.
So we have the cytokine storm. Now we have cells that are acting crazy.
Right. So if you're in this kind of even moderately hyperglycemic state, you're really not helping your body out. You're damaging your ability for your body to have a.
This is so interesting. I'm
system.
so surprised that this is the angle you're taking.
Really?
Yeah.
I'm a nutritional therapist. What angle do you think
I know.
From?
It's so wonderful to talk to you about this, because from a medical standpoint, you think of the immune system, like what kind of drug can I give you? And,
right.
And you're really coming at an angle from your dietary approach and your nutrition and your homeostasis.
Right. I mean, like you really have to.
I'm sorry to interrupt, but I just want to say this. Like right now, currently, there's a problem in our country, in the world. And who are the people primarily affected? People that are obese. People that are obese are not primarily, but one of the big risk factors. The incidence of diabetes in that population is super high. And hyperglycemia is probably, if you take all those people, their blood sugar levels are probably on average a lot higher than someone who's not obese.
Yeah.
So leading to dysfunctional dRNA to RNA, I think it's transcription, and then RNA to protein translation.
Yes.
Is that correct?
Yep, that's correct. Yep, very good.
Thank you. Checkbox.
Yep. He's a doctor, guys.
I just passed freshman high school biology. Good. And then so you just have complete cellular dysfunction. That's so interesting.
Yeah, and it's a really important thing because many people, even healthy people, can be going through extreme cycles of hyper and hypoglycemia.
Yeah. So what causes things? Stress can lead to hyperglycemia. Mm-hmm. Why is that? Because of cortisol. Cortisol dysregulates your glucose metabolism and the way your body deals with glucose and insulin. Some people are type 1 diabetics. They could be of normal weight and have really no insulin or just a dysfunctional pancreas. Yeah. You can have insulin insensitive, or in those cases are people that are obese. Their insulin doesn't work as well.
Well, or even people that have issues where they may not be obese, but like things like polycystic ovarian syndrome that really mess with your ability to regulate your blood sugars, or if you're taking certain medications. Corticosteroids or glucocorticoids are a big one because they change the way your body processes glucose.
I remember giving people steroids in the ICU for obvious reasons because they're really sick and their blood sugars would just shoot way up.
Right. And that happens to people that are inpatients in the hospital. Mm-hmm. So
and then you'd have to start them on an insulin drip, even though they're not diabetic.
Exactly.
Yeah. I mean, they're sick, so they're not being able to manage their glucose well, and they're on parenteral nutrition, meaning that IV nutrition.
Right.
So they're it's terrible.
Not healthy. Yeah. That's bad for your blood sugars. Or even just eating a hospital diet is not great for your blood sugars. So when you kind of take a step back and think about how the immune system functions, really what's going on, what can go awry, if you don't start with, am I metabolically healthy? You can do all you want as far as supplementation goes, and you're not going to be helping yourself. You're fighting a losing battle, because if you have this chronic inflammation and this chronically elevated blood sugars, it's going to be really hard to fight something off, anything off. Whether that be a big thing or a small thing, your body's just not going to recover very well.
So what I hear you're saying is to survive a viral pandemic, you got to be keto. Is that what you're saying?
No, not at all. I'll go back to my podcast about being at the Nutritional Therapy Association conference and learn all about keto.
Keto's the way.
Yeah. No.
Keto's Welcome to Keto Podcast 2.0.
Oh my gosh, there's so many keto podcasts. So
keto.
Is there a pill for an ill? I love this picture. It's literally a capsule with fruits and vegetables and beans coming out of it.
We use this on our website too, because I love this picture too.
It is an awesome
for recovery.
Picture. Yeah, it's a good picture. Yeah. So let's talk about supplementation. So there are a few things that people right now are really, really talking about, specifically vitamin D, zinc, vitamin C. So we're going to kind of go through those, also some advanced support and other ways to improve your immune system naturally. So if you have made it this far and you're
according to Joe Rogan and Rhonda Patrick.
Right. I've listened to Dr. Warren and Amy talk kind of crazy nonsense and medical jargon for a long time. Let's actually get to the meat of this.
Let's get to some real stuff here.
Yes. So vitamin D. There's a lot of buzz about vitamin D. Vitamin D, we call it sunshine vitamin, but it's not really a vitamin, it's a hormone. Your body can synthesize it, which is why it's not a vitamin. It's something that you get from the sun. Your body makes it.
It's actually a hormone.
Yep. Yeah, your body makes it. You do not make without, you can make vitamin D with nothing else but sunshine. That's it. Nothing else.
We're like vitamin D factories.
We are. We actually really are. So obviously, if we make it ourselves, it's probably really important, right? Makes sense that we would need it to survive.
I would think so, yeah.
Yes. So it is something that we definitely need. Deficiency is actually pretty common, especially above the 37th, the longitude, latitude thing.
Yeah. Very common. In this country, hugely common. And what's even more interesting, if you look at people that are, by their genetics or their heritage are from the Mediterranean area or more near the middle parts of the earth.
Yeah.
Darker skinned, usually they have melanin to protect them from the sun. In those areas where the sun is so bright and so constant, they make enough vitamin D, but then they move up to northern latitudes and they don't get as much sun. And plus they have the protective nature of having melanin in their skin. Actually, in this country, African Americans primarily have a higher incidence of vitamin D deficiency, which again, this stuff we're dealing with right now, one of the risk factors is being African American. So they have a higher incidence of obesity and vitamin D deficiency, and they think that's somewhat associated.
Yep. Vitamin D is obviously, like we said, it's a hormone, so it is necessary for life. It's a cofactor with calcium, so your body cannot absorb calcium without sufficient vitamin D. But you can also become vitamin D deficient by taking calcium supplements without supplemental vitamin D. And this is why supplementation is never something you should just start doing without really thinking about it. A lot of women were told for years and years to prevent osteoporosis, you take calcium, so they're taking massive amounts of calcium, depleting their vitamin D stores further. Like, it's a bad situation
and
to be in.
what did that do to their pineal gland?
Not good things. This is also why these women as they age couldn't sleep. So it is key for immune function, though.
Yeah.
Like, your immune system needs vitamin D to function. If you are depleting it because you're not getting enough sunlight or you're taking lots of calcium, like, there are a lot of things that you can do to deplete vitamin D. It is generally safe to supplement with, but you probably only need it seasonally. Like, vitamin D is something that you could take all year round if you need it, but most of us don't need it in the summer.
So the average patient or person, when they go outside and get sun, especially now, I mean, we were isolated, everybody was on quarantine, they probably weren't going out as much, but now where things are opening up, just that mere fact of getting sun, obviously with sunscreens, you want to protect yourself from skin cancers. Is that enough for most people?
It isn't if you're wearing sunscreen.
Oh, okay.
Yeah, so if you're wearing sunscreen, you will not be synthesizing vitamin D efficiently.
So your choice is either vitamin D deficiency or melanoma.
No. So small doses of sun are enough. So even being outside without sunscreen for 10 minutes, now I would always recommend you have sunscreen on your face, but on your arms and legs, like, is getting as much of your body exposed to the sun as possible, like, decreases the amount of time you need to spend. So if you literally lay out with as little clothing on as possible.
So, okay, in my neighborhood, if I go out with no clothes on,
You got tall fences.
for 10 minutes,
Yep.
cover my face because I don't want to look old
Yep.
and haggard and sun exposed, and I get sun for 10 or 15 minutes a day.
Yep.
Okay.
Yeah, you'll be fine. And the reason for that is because vitamin D is a fat-soluble vitamin. I'm going to keep calling it a vitamin because that's commonly referred to. So you store it in your fat cells. So you can store vitamin D for long periods of time. So typically, like, if you're outside enough in the summer, you're going to store enough vitamin D that you don't need to supplement. And that's why it's really important that before you start taking vitamin D, you should absolutely have your vitamin D blood serum levels checked. Because if you don't need it, taking more, especially in excess, can have negative side effects. Like, too much vitamin D can be a not good thing, especially if it's a supplemental form of vitamin D.
So Rhonda Patrick didn't say that.
I didn't listen to her talk about it.
Right.
So you should absolutely have your blood serum levels checked. It's an easy test, easy blood test to have your vitamin D levels checked. Very important when you're supplementing with vitamin D.
So I had mine checked. Mine was a little bit low. You got me vitamin D drops.
Yep.
So how does it come? Like, what are the different things that
So
comes?
my favorite way to have people take vitamin D is an oral drop. So like an oral suspension, which is just one little drop. That bottle I gave you has 550 servings in it, and you went through it in like 3 months.
More is better. America.
Right? So I like it as an oral drop.
I had it in the office, and I pulled it out and I was, took whatever I did. And she's like, that is like triple the dose.
He squirted the whole thing into his mouth. I'm like, what are you doing?
come on.
Drop, not one dropper.
So it's one drop?
One drop.
Oh, I'm sorry. I
Yes.
missed that. The
So,
verbiage.
and I think I actually had you taking 2 because your levels were low. But the reason I like it as an oral drop is because let's go back to the fact that it's a calcium cofactor. So in your mouth, your teeth are made up of bone, right? There's a lot of bone. There's mucous membranes in your mouth. So when you take it as a drop, you actually enhance your oral health.
Oh, nice.
Get it right in. Like I tell people, like, put it in your mouth and kind of like rub it around a little bit.
It's those who don't take this and you're doing an oral drop, it's kind of oily, but it's not like a bad oily. And it has almost a nutty taste to it. It's not bad. It doesn't taste bad. It's totally tolerable.
Kind of has no
now,
taste.
the B12, on the other hand, is terrible.
Right. Well, and there was the vitamin D I used to use was in it tasted like pencil shavings. It was like this white liquid. It was really thick. So the new one I like a lot better because it is easier to tolerate. Like, people didn't love the really dry, pasty taste of the pencil shaving vitamin D.
That one's totally fine. It doesn't bother me at all.
I love it. And if you're interested, it's from Apex Energetics. You can get it from healthcare professionals. It's awesome. So, and like I said, the bottle has 550 servings in it. So if you're doing one drop, it'll last you for more than a year.
Or you could do 3 drops.
Right. And there are people who do need more. I mean, obviously, if you have low vitamin D, it's not uncommon for people to go and get these vitamin D infusions that are like 10,000 UI. I mean, like they do really intense, like high dose vitamin D, but I much prefer to keep your vitamin D levels steady rather than trying to overwhelm your body.
What is UI? Like, what is one drop?
In the ones we have, it's 2,000.
Okay. I think some people take like 5,000 a day. That's
4,000 is probably the standard in a pill, but remember in a tablet, your body has to digest that and break it down, so you're not really going to absorb 4,000. So the 2,000 that you're getting in that tiny little drop is highly bioavailable, meaning you are getting very quality vitamin D from that. Your body doesn't have to digest it. You don't run the risk of like losing a lot of it through digestion.
So not expensive, easy to get. Doesn't have a lot of downsides for doing it. I mean, I guess if you really overdid it, there's obviously some negative effects, but it's really like a no-brainer. And then think in America, United States, I mean, there's a high percentage for our population that is vitamin D deficient. Now, that's not true in more sunny areas. I don't think like the Mediterranean and people near the equator, but
well, it can be if they're wearing sunscreen all the time.
Yeah, okay.
And or not not being outside.
Yep. So I think it makes sense. Now, vitamin D deficiency, how does that affect the immune system?
So being vitamin D deficient actually affects far more than your immune system. And this is one of the really amazing things about vitamin D is that because it is a hormone, it affects the way your immune system functions, meaning it needs those cofactors. It needs vitamin D like to build parts of your immune system, but it also really impacts your mental health. So kind of through the whole cycle of the body is all interconnected. If you're super depressed or super stressed, like you're going to be depleting your vitamin D and your immune system is going to struggle
multiple
because
parts
of
of your body.
Yeah.
Has that kind of sleep effect. It's one of those things that affects many different things.
Yeah. And
I know that vitamin D deficiency has been related to certain cancers. I mean, you can just research this yourself. There's so many things that vitamin D deficiency.
Bone loss. I mean, bone loss is a big one.
Big one. Yeah.
Because of the calcium cofactor. And depression is another one. Like it is a hormone that's necessary for some of those hormonal functions that help with your mood.
But right now, the immune system is really the hot topic, and definitely vitamin D supports that. Is that correct?
It does. Yep.
Okay.
It's necessary. Like your body needs vitamin D to function healthy with your immune function.
Wouldn't it be funny if this whole problem we're having right now is solved by vitamin D?
Well, and there's a lot of people who are saying that online, and that's really not.
Well, no, because the reason they're saying that is because the places that are primarily hit tend to be north and south of the equator. And if you go along the central line, well, Italy, wait, what am I saying?
Yeah.
Italy is, so, but, yeah, exactly. Yeah, exactly.
Not it at all, people.
Yeah, I know. But that's what was one of the arguments. But it's just so interesting that at the very least, you could take something like this, which doesn't cost a lot of people money. They can order it right now online.
You should definitely get a blood serum level before you start taking
Check
vitamin
it.
D.
We're not your doctor. Please go see Amy or your doctor. And, get that checked out. But I mean, I think it's an easy answer with not a lot of downsides. So.
Yep, it is. It's generally safe to supplement. Absolutely. So a good option. It's not a cure. And this goes back to you are liable to be more sick from anything if your immune system is not functioning well. So if your immune system is not functioning well, you're vitamin D deficient, like anything you get is going to impact you more.
Yeah.
So just in general. So let's talk about zinc first, and then we'll go back to vitamin C. So zinc, yes. So people have heard a lot of things recently that zinc.
Who is that coming from? Like,
zinc is going to cure
who's
everything.
like the zinc proponent that's out there just won't shut up about it because everyone's talking about zinc now.
Yep, there are a lot. So zinc helps it activates T cells. Right, so zinc is what kind of...
And we remember from your amazing diagram from Mommy Immunology. What was that called?
Mom Immunology. Something.
Whatever.
Yeah.
So you remember the T cells are a big part of the immune system. T cells actually really help present the antigens to whatever cells they need to attack it or the foreign objects and get rid of it. So
yeah, so... Zinc has to get into the cell, though, and that is why it's become such a hot topic lately, because there are receptors on your cell wall, like keys, like little spots for a key to go into that let stuff in.
Yep.
So if the zinc can never get in, like let's say the little pathway that the door is blocked, then the zinc can't get in. So this is why taking tons of supplemental zinc is not really helpful, because if the zinc can't get into your cell, it's just excess.
Yeah, but you could filter your urine and just keep drinking your urine. So it's a cycle, because if you pee it out and just
put it right back in. Don't do that.
That's why I don't like supplements. And I know you and I have this discussion, but at some point you're just going to urinate most of this stuff out.
Yes. Best case scenario, yes. If you're overtaking some other vitamins, though, that's
you don't
not
poison
the case.
yourself.
Yeah, you're
Okay, I got
going to
you.
make yourself toxic. But
non-toxic levels, you're just going to pee it out.
Right. So. Deficiency in zinc is extremely uncommon because it's very easy to get through a healthy diet, and also a lot of foods are fortified with zinc in this country. So it's not common to be deficient. And the issue in most people who have issues with getting zinc into the cells is not that the zinc isn't present, it's that it's blocked, it can't get in. So if the zinc can't get in, we go back to the cell, my basic cell version, like Dr. Barnes said, it's the T cells. So the zinc has to get in to activate the T cell to come in and be like, hey, this is bad, come kill this. So that the T cell can come in and be like, okay, I've studied this, I'm going to kill this, I'm going to tell the other T cells to kill this too.
Right, and the T cell is primarily the innate immune system, and it's involved in both. The innate immune system is what you're born with. This, like when you have viral infections like we're currently dealing with, the innate immune system is the big player, right? And then you build antibodies. Everyone's heard about antibodies. That's what's the other, that's not innate, that's adaptive. And that's what builds over time. So theoretically, people that have been infected recently that have positive antibodies in their plasma will be protected in the future. That adaptive immune system will help in the future. So the innate immune system is really important right now when these new viruses come through. And so that's the idea, that you give yourself zinc and you supercharge your T cells, right? Is that kind of the idea?
I think that might be what people think, but that's not in actuality what happens at all. Like that's actually not what happens.
Are you saying that we should just all eat keto? Is that what you're really saying?
Definitely not. Boy, there is a lot of misinformation going out on this podcast.
I'm sorry. I mean, you just know so much about this stuff, but I'm just saying things to get underneath your skin. So, I mean, the reality of it is zinc is important. So what does someone do? Like me. So I think I want to take zinc, right? What do I do?
Well, you should first talk to someone about it, because zinc, while it is generally safe to supplement, it's best to supplement only occasionally or when it's needed. So if a time period, great example, you just came off of trauma call. If we had talked about this last week, I would have said, like if you're concerned, you should take some zinc during your trauma call week, some extra zinc.
Why would that be?
Because again, it's going to just make sure that you have enough should your body need it, because you have some type of viral infection, that there's enough zinc present.
Oh, you mean because I have more exposure?
Correct.
Oh, that's really, I get that.
Because your exposure is high.
Oh, okay.
Now, for someone sitting at home right now, or at any period in time, to be loading up on zinc is not a good idea.
Right.
It is not necessary.
So what about, okay, good question. What about before surgery they have to have?
Again, I would not really say they need it, because they're not getting any type of extra exposure per se.
Okay.
They're not in and out of an ER.
Right.
Now, if someone...
They're not in high risk areas.
They are not.
Okay.
Yep. So I would not recommend it. Now, there are some very anecdotal studies that have been done with zinc that shows that it can help fight like the common cold. Now, in those periods, like if you actually are sick, you have to be very careful, because a lot of supplements might contain zinc. And if you're also taking a multivitamin that has zinc, and then you start taking these over-the-counter things that have zinc, you can very rapidly exceed your recommended intake of 8 to 11 milligrams per day. Zinc has a negative effect on antibiotics. So if you're taking antibiotics, you should not be taking zinc, because it's going to deactivate your antibiotics and make them not as efficient.
Not all of them, but some of them.
Some of them, yeah. Many common antibiotics.
Right.
And if you're in doubt, you should probably not be taking your antibiotics with zinc. So the two things don't really play well with others. There's also some other common medications that are not good to take if you're taking extra zinc. So you should definitely talk to your doctor before you start taking zinc if you're taking prescription medications, or if you're going to be taking prescription medications. It's another reason why I wouldn't recommend somebody start taking a bunch of zinc before surgery, because we generally prescribe antibiotics. You're given antibiotics at the hospital. Like you're kind of fighting yourself a little bit there. Because deficiency is so uncommon, it's not something I recommend supplementing with, and you definitely don't want to supplement with it for extended periods of time. It should be short duration.
So to download Amy's brain, zinc's kind of a little bit overhyped right now.
Supplemental zinc, yes, because it's unlikely that you're going to be deficient.
Okay.
Yep. Now, if you're sick, your body's probably using a lot of zinc. It's needing it. It's needing it to feed those cells. So if you are actively sick, taking zinc may be okay. Again, only occasionally when needed. Taking it when you're not sick is not going to help you when you get sick.
Okay, we got it.
Yeah. So that's my story on zinc. Oh,
Whoa,
yeah. We got to go back to vitamin C.
Vitamin C.
Oh, yeah, vitamin C.
It's our favorite, scurvy.
Right? Everybody heard about scurvy from the pirates. So deficiency in current times, and this is true deficiency, meaning you have scurvy. You have to have such low levels of vitamin C in your system to get scurvy.
I don't know if I said this during your last time we talked about this, but I had an attending, we were doing ICU rounds. I'm like going way back this whole episode. And he looked at the patient and he goes, I think that patient is scurvacious. And he kind of smiled, and I was like, oh my, we are the biggest nerds. Like, he really thinks that's a funny joke.
Did he have scurvy?
He did.
Okay, so.
He was vitamin C deficient, but it was He was saying it tongue in cheek.
Yes, scurvaceous.
Scurvaceous.
It's funny. So it's uncommon, though, to be deficient in vitamin C because, again, a lot of foods are fortified with vitamin C. It's just very uncommon in our current society. Now, that doesn't mean that your vitamin C levels are optimized.
So right now, like that's another thing going around. Everyone should take a lot of vitamin C, right? Is that correct?
I haven't really heard that going around, but I don't tend to watch snake oil salesmen on the internet.
Nels, have you heard that?
Yeah.
A little bit?
There's a little bit of that.
Yeah, going around.
Again, from the bad information.
Yeah, from the fitness person.
Yes.
Do 5 push-ups. Yeah. Vitamin C.
So vitamin C is extremely safe to supplement with because it's a water-soluble vitamin. There's no need to cycle if you're taking vitamin C. You don't want to take extreme doses of vitamin C for an extended period of time because that can become a problem. Now, there is stuff online right now where there are medical studies with IV infusions of vitamin C at extremely high dose.
I think that's what they were talking about with this.
Yeah, and that is used. And I mean, there are actually some great research on using vitamin C to treat certain types of infections in extremely high doses by IV. So you could not replicate that on your own, and you should never try.
Yeah.
So a good amount to take of vitamin C, and what I recommend that people do is 1 to 2 grams per day. So if you're taking a 500 milligram tablet, you do 2 a day, 1 in the morning, 1 at night, you're good. If you're feeling like you've been, again, at high risk or exposed, you could take more, but this is definitely one that you're just making very expensive urine, because you will pee out what you don't use. Vitamin C cannot be stored in the body.
That's a startup company. Just have people pee into cups. You send it off in the mail. We process it. We take all the vitamins out of it, reprocess it, send it back to them.
Would that be less expensive than them just taking more supplements the next day?
That's a good point.
Yeah. So
I got to rethink my business plan.
Yeah. And your body breaks them down, so the byproducts are often unusable.
Gotcha.
So they are not going to be beneficial to reconsume your own urine.
So who takes vitamin C supplementation? I mean, most of us are pretty good because we have it in our diet. A lot of our patients are, healthy eaters, so they get a lot of vitamin C. So who needs vitamin C?
So there are definitely times when you need vitamin C. Vitamin C, we've talked about a lot on our podcast because it's necessary for collagen production and wound repair. When was our podcast about supplementation around surgery? Probably 2 years ago. Maybe 3. Yeah, it's been a while. So that was one of the things I recommended.
We have tons of episodes. We're 75 episodes now.
This is one of the things I recommended for people to take around surgery because you need it. You need it for collagen production. You need it for wound repair. You need to take it every day during that time period because your body is using it rapidly. So it helps with reducing free radical damage. Helps keep your cells healthy. You need it for collagen. So
that's huge for collagen production.
Yeah. If you are having surgery, just had surgery, have a type of injury.
So injury, surgery, anything that requires rebuilding, vitamin C supplementation may be necessary.
Vitamin C is really good. Depletes especially quickly during times of stress or recovery. We talked about the recovery component, but if you're very stressed, either emotionally or physically very stressed. So people that are training for like a bodybuilding competition that are working
people
out
that are
a lot.
quarantined and out of work.
Or marathon runners, people that are putting their bodies, or triathletes, anybody who's in an extreme training cycle should be taking vitamin C.
Definitely. Those really intense kind of athletes.
Yeah.
I mean, vitamin C is probably necessary because you think about, for them, especially any kind of work, people that do really kind of intense workouts, you get a lot of damage, right? I mean, that's how you get anabolism. That's muscle protein synthesis. You get damage and the body repairs it and builds more muscle. So
yeah.
So vitamin C would be important there.
It is. And is it safe to take? Generally, yes. You don't need to have any test done beforehand. As long as you're not exceeding 2,000 milligrams or 2 grams a day, you're going to be just fine. And you can do that every single day with no downside. Now, do you need to do that every single day? Maybe if you're one of these people that's extremely stressed or you have recovering from injury or getting over being sick, it's a great time to supplement with vitamin C. And there's not a lot of downsides. So it would be very challenging, but it can happen.
Plus, I love grapefruits.
Grapefruits are high in vitamin C. Yeah, all citrus fruits are.
Yeah.
Oh, you didn't. You had the perfect opportunity in this podcast to ask me where you can get these things from food. And cod liver oil would have come up.
For vitamin D?
Yes.
Oh,
highest natural source, highest food source, vitamin D.
I think that you,
cod liver oil,
during this time of isolation, just sat at home and had cod liver oil parties with yourself. And you just put little teacups around and had fake conversations with people.
Right, you want some more cod liver oil? Yeah, that's what I do at home.
Would you like some more?
So, there are food sources for all of these things too. And that's why things like zinc, you're getting mostly from food, especially if you eat a lot of shellfish or any type of, a lot of nuts, a lot of red meat, properly sourced red meat. You're getting a lot of that. What about
leafy greens? Do they have vitamin C in them or not?
They do.
Okay.
Yep. Yeah, anything. I mean, if you think about stuff that most things that grow in the ground have vitamin C in some concentration.
Yeah.
Your highest sources are going to be your citrus fruits. Yep. But all vegetables have a breakdown of a lot of vitamins in them. So,
Great.
Yeah. Okay. So let's talk about advanced support. So these are all on one
Oh,
slide.
I'm doing some of these.
You are. So these are things that definitely
I'm advanced.
that show some promise for supporting a healthy immune system on a much deeper cellular level. And these are, I call them advanced support because these are things that, like, if you have the money to spend, these are things that might be good to add in. Glutathione is the first one. And glutathione is like the master antioxidant. Like, it is involved in basically every function in your body. It is key in methylation, which is how your cells are basically functioning and how they are expressing their genes.
Right.
Methylation, if it's not functioning well, your body is not very healthy. But it also is key in detoxification, hormone health. Like, your body has a lot of glutathione because it's in all your cells except for red blood cells. Red blood cells don't have glutathione, but all your other cells in your body have glutathione because it needs it. So when you're replicating, like you and your daughter were talking about the processes that happen in a cell, there are these reactive oxygen species that come out inside the cell, and the glutathione deactivates them.
Yeah.
So if you are deficient in glutathione, this is why, like, your cells are going to start to struggle because they're going to have a buildup of toxic waste essentially inside them and no way to get it out.
And if you have like a viral infection that causes a cytokine storm or, this kind of inflammatory reaction, and you don't have enough glutathione, I mean, it's more complex than that, but they're to absorb these radicals that are being released, it could be very damaging to your body and result in dysregulation.
Yeah, and the slide I didn't put in is the one that shows how glutathione is made or recycled. We call it recycled in the body. It's a very labor-intense process. So your body can create more glutathione, but it's not very fast, and it uses a lot of other energy. So if your body's in a state of extreme stress, it's not going to be making a lot of glutathione or making it quickly enough to make up for what you're losing. So it's a great thing to supplement with. There are a couple ways to take glutathione. My preferred ways are, again, through a liquid because it's very highly bioavailable. Glutathione in a pill that you get from most places is going to be kind of worthless. Your body's not going to absorb it that way.
All right, stop the press here, because you got me a pill, but it's not. It must not be glutathione.
It's not. It's a glutathione recycler.
So why is that better than glutathione?
Because you're healthy and eating a healthy diet, and I couldn't get you to actually use the glutathione I gave you. So next best is to have you take a pill that will help your body make more.
You're saying your patient wasn't compliant?
No. So there are good natural supplements.
Is there a benefit to the recycler over glutathione itself, or
no? They're both really good. Yeah, I mean, one is helping your body make more, one is adding more, essentially. I think there is some benefit to encouraging your body to function better versus supplementing if you don't have to.
Yeah.
Glutathione, like I said, I like it as an oral and also as a cream.
Okay.
But getting people to be compliant with rubbing the cream on can be a challenge.
Yeah, that wouldn't be me.
Right. So, yeah, it's expensive. So if you are taking like lipozymal glutathione, again, I would recommend getting it from Apex Energetics.
Not a sponsor. We're just
We're not, but that is the supplement line that we carry.
Yeah.
Highly bioavailable. It's pricey. I mean, you're probably going to be spending upwards of $80 to $100 for it.
A month?
Mm-hmm.
Oh.
Yep. So it is pricey. Yep. But, if you are...
That's what they give you at the Four Seasons when you check in.
Right. Yeah. Like, here's this for your $500 night stay.
Yeah.
Yes. You get one dose of glutathione.
And a mask.
Yes. The next one is NAC. So this is something that a lot of people may have suddenly heard about too, because it's has a lot to do with how your cells function and your immunity.
I want to say that, I keep bringing them up. Joe Rogan, like, it's IV NAC infusions. Is that correct?
Probably.
And he's been doing that during this whole crisis.
Yep. And that, there again, if you can afford that, I imagine that is extremely expensive. Could that show some promise in boosting your immunity? Yes. It's a necessary part of your immune system. It's basically a triprotein. So it's a little, blend of 3 little proteins, very necessary in your immune function and how your cell walls function essentially too. So it can be taken in a pill. You can also get it Joe Rogan style in an IV. Not expensive. You can get this.
You mean the pill's not expensive?
Pill's not expensive. Now, how much the pill is actually going to do, we don't really know. Most of the studies are really high dose with this kind of thing. But if you are looking to kind of do some advanced support and don't want to spend a lot of money, NAC is a good thing to
it's so funny with these supplements, by the way. We didn't get into any of the stuff, but the bioavailability, the way it's processed in your gut and how much gets absorbed, what happens when it goes to the liver, does the liver take it out, and does it really get into the bloodstream?
Right, and does it go anywhere?
Does it go anywhere? Does it do anything? You know, and then a lot of these supplements, I mean, to be honest with you, are made in China and they're not regulated. So
most supplements are not regulated.
Right. And that, so I think we all need to take this with a grain of salt. What I love about what you're recommending is really basic, but really true things. And you're not complicating it with these, we'll talk about that in a second. This right here, this no one else can see what I'm pointing at. That's one thing I wanted to talk to you about. But I do think it's really important to remember that things like NAC, if you're taking it orally and not IV, you should look at the bioavailability once it gets through the gut and see how much is actually in there.
And it's never going to make up if you have not addressed the foundation.
Yeah.
So again, if you have uncontrolled blood sugars and all this other stuff going on, like you take all the NAC you want, it's really not going to do a whole lot to help your immune system.
Okay.
But N-acetyl-L-cysteine is the big name for it if you want to look that up. But NAC, you'll find it too.
Fancy pants. Okay, next one.
Next one is DHA. Take
that too?
Yeah. So it's really important for managing inflammation. So these are your essential fatty acids.
That's omega-3?
These are primarily omega-3s. Yep. So your omega-3s and 6s are going to be, primarily 3s are going to be very anti-inflammatory. 6s and 9s can be slightly pro-inflammatory in some concentrations, and we tend to get a lot of 6s and 9s.
omega-6s in our diet.
And 9s. So you don't need to supplement with those typically.
Yeah.
So a good DHA supplement that is just omega-3s, really going to help your body with processing inflammation and managing inflammation, especially on a vascular level, which is, currently we're dealing with an endothelial disease or something that attacks our endothelial system. So if you want to make sure that you keep inflammation in your blood vessels as low as possible.
So DHA for sure.
Yep, that's a great one. And they're great sources. Again, I love Apex Energetics. It's a very high quality. When you're looking at supplementing with omegas, a lot of them can be very low quality. So you want to make sure you either buy a really high quality one or make sure you're getting one that's refrigerated if you're not getting one that's like a pharmaceutical grade, because they can just have such a low concentration or be very toxic. Like they can be processed from sources that are high in pesticides and other things. Like even fish, are getting a lot of toxic.
Yeah, like lead. And,
yeah. So you'll make sure you get a really quality fish oil.
Okay.
Or omega. Next one is quercetin.
Yeah, this is the one that was really interesting to me. So I've been taking this right when all this stuff started. You said you got to take this, and of course I didn't even ask you what the hell I was taking.
It's a bioflavonoid.
Yeah, and it comes in just a regular pill. It doesn't taste bad. So you take it. I take it 2 times a day. Hopefully that's what I'm supposed to do.
Yep, 500 milligrams twice a day.
Okay. So what is that actually doing for my body? Because I actually, after I started taking it, and then I actually did the research, it was really interesting to look at that.
Yeah, so it's a bioflavonoid, and it's probably the most prevalent bioflavonoid. It's very, very common in onions, apples, broccoli, like a lot of it. It's really yellow. Like if you're taking a quality supplement, it should be very bright yellow, almost like turmeric.
Yeah, it has that turmeric color.
Yep.
Yeah.
Only more of a pale yellow versus that kind of yellowy orange.
Yep.
Yeah, it'll stain stuff too, just like that. Bioflavonoids help fight free radical damage.
So just like the glutathione, this is the same idea. These free radical kind of so-called antioxidant, but it's not just an antioxidant.
Right.
It has different terminology. But you get the idea. These free radicals, it mitigates the damage that those cause.
Yes, and that's really important. It's important to make sure that you have enough. Now, bioflavonoids are in small quantity in things. So that is something I would recommend supplementing with if you're wanting to do some advanced supplementation, because it's hard to get enough of it from food to really make an impact on your system.
Okay.
And that's why I would recommend supplementation. It's not something that you can get or need a blood test before you start taking, but there are some thoughts that you shouldn't take it for extremely long times without breaks, like you might want to cycle it every 6 to 9 months, like take a week or a month off. But taking 500 milligrams twice a day is what I have recommended for Dr. Martin. That's what he's taking. It's what I'm taking.
It's not too expensive either.
It's not. I mean, a very big bottle, and I like Jarrow is the company I like for it, because
Made in America.
It is, and it's just it's a well established supplement company. They have really nice processes. They're pretty easy to track their sourcing, and it's inexpensive. So you can pay a lot for this supplement, or you can pay a moderate amount. And the Jarrow one I like because it is reasonably priced, but I also trust their sourcing.
Nice.
So mushrooms is the next one on the list. And by mushrooms, I don't mean like magic mushrooms. I mean
you
things
don't mean like shrooms.
Right, I don't mean shrooms. Although that might help. I mean, if you're stressed out from being in quarantine.
Let's be honest.
Right?
Not our thing. It's not
No, but if you're in a safe space.
But if you're in a safe space and you're quarantined, I mean, shroom it up.
Right? Like
We're in Colorado.
It helps you get through the day.
I actually think shrooms were legalized in Colorado for something. I can't remember.
It's for counseling. Like they can use them for
in microdosing. Yeah, for severe depression.
Depression and also like marriage counseling, surprisingly enough.
So interesting.
Yeah. So I'm not talking about trippy magic mushrooms. I'm talking about things like reishi mushrooms and lion's mane. Anecdotal.
Of course, lion's manes. I mean,
yep.
I can't tell you the last time we made an awesome meal with lion's manes. Mushrooms.
So, mushrooms are really cool. So if you look
Why?
at
Where do you come up with these names? I've never seen a mushroom named lion's manes.
they are
Like, are they
it's
at the
a
store?
common mushroom. Oh, they're hard to find in Colorado,
Oh, okay.
but yeah. Or chaga is another really great medicinal mushroom that's not a psychoactive mushroom. But if you look at a mushroom, like you look at the cellular structure of a mushroom, it's very similar to the cellular structure of lungs. So if you are concerned about lung health or want to make sure your lungs are really healthy, taking it's like helps like walnuts look like the brain. Like walnuts are extremely helpful for brain health. Mushrooms look like your lung tissue. Very helpful for lung health. You hate this podcast.
I mean, I love it, but like this is so hard. Like you're eating food that looks like the organ that you want to help.
Yes.
That is like literally what you just said.
Yes, I did.
Okay.
Eat those peaches, ladies.
So don't eat anything that looks like fat, okay? Because that will become fat.
Well, or it'll help your fat.
Oh, that's a good point.
Yeah, maybe I think fatty things actually help support your your fat. So that is a good thing.
Actually, when I tell you like, I'm not feeling right or you always recommend, eating more fatty foods.
Yep.
Because of the benefits that the actual dietary fats do for your hormones and for your immune system.
Yeah, and your body
can
can
your brain.
use them rapidly too. So if you're feeling like really brain foggy or out of it, I mean, hitting a good shot of MCT oil, if your digestive system is adapted, is actually really helpful to kind of clear the brain fog.
Yep.
Yes, so fat does help fat. I mean, your brain is 90% fat. Like it is made up of fat. So eating fats to support your brain, like DHA, very, very good for your brain. Like that's what it's for.
Coming back to keto again.
Brain health. Yeah. With some mushrooms thrown in on the side. There you go. Keto diet.
Lion's mane keto diet.
Yes. So very much in my realm here, we're going to continue to talk about how you can improve your immune system naturally.
Yeah. This is awesome. Like I'm down with this.
Key thing here.
Yeah.
Properly sourced nutrient-dense diet. Wow. A couple of years ago, Dr. Brian and I were getting ready for a podcast with somebody, and we were having an argument or a discussion about what was the most important thing to consider with your diet. And I said, food sourcing. And you wanted to go back to like your macro breakdown, like, nope, like food sourcing, because you cannot, and there are a lot of people who like to compare 4 Oreos to an avocado and tell me that your body is going to feel as good.
Right.
But
so you're saying if the fat content is the same in the Oreos versus the avocado, that's what you're really saying.
I'm saying the calories are the same.
The calories, I'm sorry, calories are equal, then obviously, I mean, it makes sense. The avocado is more healthy for you than.
Right. Nutrient density. So if you are wanting to optimize your health, optimizing the sourcing of your food is very much at the top of that list. Very high on the top of the list. No one's ever going to feel worse in life because they stopped eating processed foods and started eating more whole natural foods.
Yeah, and that's the real takeaway from flexible dieting. That's the problem, right? Because you can do flexible dieting and eat like crap, or watch your macros and watch your calories and still eat terrible food. It's almost better to eat more calories and eat more healthy food or more nutritionally dense food than just to make it all about your macros.
Yeah. Calories are not, we've become so fixated in our culture about a calorie, but the description of the avocado versus the Oreos is a good example of showing you that a calorie really doesn't mean much if your body doesn't know what to do with it.
Right.
You eat those 300 calories of Oreos or the 300 calories of the avocado, and your body is going to feel
really
very
getting on
differently.
all the hot button issues right now.
Right.
Yeah.
Well, if
someone's going to throw a spear at us.
Pop-Tart zealots are out there.
I know.
You can come for me. It's okay. I can
No, but it makes sense. If you're focusing on nutrient-dense foods, you're going to have a more healthy diet. You're probably going to live a more healthy lifestyle. There's things that go along with this that aren't
reduce your inflammation.
And reduce your inflammation that aren't just related to calorie intake. And yeah, calories in, calories out does exist. You and I believe that. But it's a little more complicated than that.
It's far more complicated than that. I mean, our bodies don't count the calories we're eating. So to think that
my body does.
Right?
I don't know about yours.
So, yep. Okay, let's just move on.
Okay, I'm sorry.
Let's talk about quality sleep. So we talked about sleep a lot in our podcast when we talked about sleep, but quality sleep is extremely important for your body to kind of refresh itself. We talked a lot about the glymphatic system and how it helps flush the brain of funk.
That was such a good episode. That was such a good episode on the glymph system. You threw that out there.
That's super
Your favorite
excited.
thing. Your
Yep.
favorite thing.
But the rest of your body is the same way. So your lymphatic system works like your lymphatic system does throughout the rest of your body to help clear waste, to help refresh and renew. If you are not getting enough quality sleep, and this is quality, not necessarily, I mean, quantity matters too, but the quality is what's really important. Everything in your life is going to suffer. Your immune system's going to suffer. Your hormone regulation is going to suffer. Like, it's just going to be really hard to have healthy immune system if you're getting really bad sleep. Stress reduction / meditation.
There's that M word. It makes me uncomfortable. You had to say it, didn't you?
Yeah, so there are great studies. And if you go back and listen again to the podcast where we talked about my experience at the Nutritional Therapy Conference in 2020.
Or you go back to the one we talked about forest bathing. We talked about meditation there.
We did, and I completely lost my train of thought.
No, you're talking about the conference you went to.
Yeah, so meditation's great. We'll go with that.
Okay.
And exercise. So both of these things help boost your immunity. They're great to just kind of help with your all-around health, obviously, but they also do help your immune system function better. Cold therapy is something we've talked about before. Cold showers, stuff we're into maybe. We talked about cold therapy.
Do you still do that? Because you would do it like in your armpits, in your neck or something.
Yeah,
right?
so I do. I still do. At the end of every shower, turn it to straight cold.
God, you're insane.
And stand there. I'm not very good at standing there for more than probably like a minute. The biohackers are in there for like 5, but I just can't. And I'm usually in a hurry when I'm in the shower in the morning. So I try to do it longer at night to get that cold therapy. So extreme cold and extreme heat in like small bursts really helps stimulate your immune system because it's like a shock.
So right now, there's certain countries that really don't have a bad outbreak. Sweden's one of them. What do they do there? They do tons of saunas, right? Is it Sweden? I think it's Sweden.
Oh, Sweden is maybe not a great example.
No.
Like Norway?
Norway,
Yeah.
whatever.
Belgium.
Okay. Wherever Nils is from, okay?
Norway.
One of those countries up there where they do a lot of sauna work. And they do sauna and then they do cold. That's culturally, like they all do that. They all have a sauna house. And they've seen that specifically in those populations that the viral infection rate is like a lot lower. And they think that is primarily because of this heat cold therapies boost your innate immune system.
Yeah, and what's the thing that gets stimulated when you're in a sauna? I just thought it and then it went out of my head. It's a certain process essentially that happens when you're in heat, the heat shock proteins. Heat shock proteins. So heat shock proteins are great because they help your body like get rid of excess waste. Like they help break stuff down.
Yeah.
Something else that's not on my list that can kind of do that same like create that same metabolic stress is fasting, like extended period fasting. I'm not talking about like intermittent fasting, but like fasting for like 36 to 48 hours can have that same effect of like kind of putting your body into that state of stress. I would much rather take a cold shower in the morning.
Right. What's the word? Hormesis?
Yep. Hormesis.
Hormesis. That's what they talk about.
Yeah. So those things are great. You can do that with cold showers. Like we talked about, hot cold therapy in the shower is great, back and forth between hot and cold. Cryotherapy. We love cryotherapy. If you can find one that's open right now, go get some cryotherapy. Infrared saunas.
There's no way a virus could withstand 280 degrees below zero.
Right? No, it's killing everything. Like you can't even breathe that in without passing out.
Even me would feel comfortable doing that.
Yes.
Right now.
Oh, I would too. I'd definitely go.
Shout out to the cryo people. Come on, we need to open them back up. That's going to help us.
Yeah. And then infrared saunas. Infrared saunas are great because they're a little more easily accessible to like something you could have in your own home. They're not super expensive. They plug into a 220.
Get them on Costco.
You're spending 45 minutes to an hour in that infrared sauna, like at a moderate heat, like 120 to 140 degrees. And you're really it's a great way for your body to kind of detox and get rid of byproducts and waste. So those things are great. Something we talked about when we talked about sleep was managing your light exposure, but also getting the right type of light exposure. Something we didn't really talk about was like red light therapy. Yeah. So those things can be very stimulating to the body. So like red light therapy shows great ability to help stimulate your collagen, stimulate your body to repair, stimulate to recover from injury.
Yeah. We have red light in that wavelength, like 650 nanometer, that we would do for people with bruising after injections. Yeah.
Because it stimulates it. So it's great to get red light therapy. It can be something that's really powerful if you're trying to boost your immunity naturally. Also making sure that you're not getting excess blue light exposure. We talked a little bit about the pineal gland and the way it functions and like the melatonin connection. And there's some research right now with biohackers talking about melatonin for anti-aging. And a lot of that has to do with if you're getting enough sleep, if you're, giving your body enough time to repair, but making sure that you're not getting a lot of toxic light exposure or EMFs. I'm going to just throw that out there if you're interested in doing some natural stuff to help your immune system. The more you can help your body not have to fight hard to do its normal functions, the better. And when you're kind of assaulting it with EMFs and all these other things and blue light constantly, like you're just not giving it the best fighting chance.
And I think people understand that. Like we used the analogy last time or the comparison to smoking, that sleep deprivation is kind of like smoking. It's just
it's like insidious.
It's really insidious and bad for you. And over time, it really creates real bad problems for your body. Light exposure is the same way. And we all need to, especially now, rethink the way we're approaching our lives and health and consider some of these things. And it's hard, me personally, it's hard, but you pick one of these things. Sleep, nutrient-dense diet. I mean, that's what Amy has really taught me. It's changed my life. Stress reduction. I'm working on that. Heat and cold therapy. I don't have the courage yet, but I definitely do the IR sauna sometimes. But we've joked in the previous episode that I sat in there for 15 minutes and I was so proud of myself. And Amy was like, it's not even hot yet. How long does it take to warm up?
It takes like 30 minutes just to warm up.
Oh, yeah. I didn't even get to the maximum heat.
Yep. And even that, so I'll usually turn on for a half hour before I get in.
Right.
So that it's hot when I get in, so I don't have to wait through the warm up.
You're so kind to me, but you didn't even make fun of me. You're like, oh, good job. Good job.
Hey, you got to start somewhere.
Good job, little Jason.
I mean, I wouldn't put somebody in there at a really hot temperature the first time they did it. They'd pass out and hate it.
It was hot.
Yeah.
It's a weird hot because it's not like a humid hot. It's a real dry, penetrating heat. And that's literally the IR waves.
Yep. Yeah, they penetrate.
Yeah.
So there are a lot of things you can do naturally. So if you don't have money for supplements or just have no desire to take supplements, then there are definitely still things that you can do to support your immune system that don't involve snake oil or you buying expensive supplements or doing crazy things, unless you consider taking a cold shower crazy.
Don't be reactionary right now. Like, look up the data, listen to people like Amy, and just really do smart things for your body. That's what it's all about.
Yeah.
You're so good. Like, I love these episodes. These are like my favorite episodes because this is real information that can help everyone. Not just people that are interested in plastic surgery or fitness or whatever. Like, this can help every single person out there. If you actually take a few of these things from this talk today and apply that to your life, it could like literally change your life.
Yeah. Managing your inflammation and managing your blood sugars. I mean, those are things that can help you avoid dementia, like lead a long, healthy life.
Right.
Absolutely. So, well, thank you so much. Sorry, it was a long one.
That was good. You were in your zone. I messed you up a couple times, and I apologize about that.
No.
You were
I need more DHA.
You're in your Amy zone, and I was like, you got to watch out when you're in your Amy zone.
Throws me off my game.
You were like dropping the knowledge today. Yeah. That was really good.
Yeah. So thank you everyone for listening. If you are interested in finding out more about what we do, you can find us on Jason Martin MD on YouTube and also at Beauty and the Surgeon podcast on Instagram. See, it's not you. I'm just having an off day. But we do appreciate
We're on Instagram.
For listening. We're on Instagram. We do the Instagram thing. We do that thing. So we appreciate your feedback, your comments, your ratings and reviews really do help us get out to a broader audience. So if you found this helpful, we would really appreciate you leaving a like, a comment, a rating, a review. It means a lot to us.
It means a lot to us. And we actually listen to your responses and we actually put those into future episodes. So
thank you so much.